Okay. Well, first, thank you for the invitation to do this presentation. And the title of my presentation is Fogarty as a Partner in My Career. But first, to be fair, I want to introduce you to my other partner, my husband, Isaac, who is also a Fogarty scholar, currently a fellow, and who has collaborated with me in all my Fogarty and non-Fogarty projects. And you're going to see him in all the pictures, so I better put him here first so you know him. So this has been my evolution with Fogarty. After medical school, I was lucky to be part of the first cohort of the Fogarty scholars in 2004. I then received 2 consecutive scholarships. Actually, Anne-Marie Kimball was my mentor, to do a master in public health and a PhD in epidemiology here at the University of Washington. And I then received a Fogarty fellowship and then a GRIP, which stands for Global Research Initiative Program for New Foreign Investigators, which is a grant that has Fogarty to help those persons who trained in the US to return to their home country with a project. And on the tip of the pyramid, I put my position now as a research professor at Cayetano, Heredia University. So as you can see, Fogarty helped me to train here in a high-quality institution as the University of Washington, but it also helped me to return home with 2 projects and a stable position there in Cayetano, Heredia. So before Fogarty, in medical school, Isaac and I traveled to the jungle thanks to a program that has Cayetano, Heredia, that allows you to travel to rural areas from Peru. Here we did a project in nutrition, and we witnessed the tremendous inequalities between rural and urban areas of Peru. And here we also fell in love with the jungle and decided that we were going to go back to conduct projects here. And that's why we have both of our Fogarty projects as a fellows in the Amazon currently. So after medical school, I actually was looking for a job, and I got an interview with Dr. Garcia, who is here now in the audience. And he gave me actually my first job, and then my life completely changed because she introduced me to Dr. Joe Sant. No coincidence that they are seated here together. And then both introduced me to my new partner at that time, Fogarty, and to a wonderful group of mentors who have helped me through all my career, who have helped me to write papers and to get funding for projects. So they have been all wonderful. My first year as a scholar was very interesting because I was able to have hands-on experience on major projects, such as the urban community randomized trial of STD prevention in Peru. Here with my partner at the time, my US partner, Evelyn, we're able to publish one of our first papers in a peer-reviewed journal. But I was also able to conduct my own project. So I did a project on the use of the internet to reach high-risk men who have sex with men that I published on STI. And this project was very important because it served as the basis of my PhD dissertation and later for my GRIP. So with Evelyn, my US partner, we traveled to several places in Peru. Actually, we were called the team of the National Geographic because we took a lot of pictures and we traveled a lot. But not for just fun. We traveled a lot, for example, to several areas outside of Lima to train physicians and nurses on how to search information on the internet. For Evelyn and I, that was something that we did on a regular basis, but we realized how limited was the information that physicians outside of Lima had on how to search information. We also went to local radios to talk about the importance of sexually transmitted infections, and also we work as part of a team on the projects for HIV prevention. Here, for example, we are working on a brothel. So after the Fogarty scholarship and as part of my PhD dissertation, I did a very interesting study that we just published in PLOS about the effect of an online video-based intervention to increase HIV testing in men who have sex with men. Here, we recruited participants, basically men who have sex with men, on the internet And those who meet our eligibility criteria were randomized to either a video or a text. So those men who have sex with men who self-identify as heterosexual or bisexual were randomized to the video-oriented, to non-gay identified MSM, or to the text. And those who self-identified as gay were randomized to this video, oriented to gay-identified MSM, or to the text. The conclusion of this study was that the video oriented to non-gay identified MSM was effective in increasing HIV testing, as you can see here in the graph. And this study was very useful to get later my GRIP award, where we are doing a combined online intervention, and then of course we are going to see if participants decide to get tested for HIV at our clinic. Also wonderful. I think in this year I have conducted one of the most important studies and interesting studies so far. We are looking here at the association between the HPV, the human papillomavirus, and the human T lymphotropic virus infection in indigenous women from the Peruvian Amazon. Here we are assessing the prevalence of HTLV in 3,000 women from an ethnic group in Peru, from an indigenous group in Peru, and we are also assessing the prevalence of HPV and cytological abnormalities in women with HTLV and in a group of women without HTLV. So here is a picture, I told you were going to see him a lot, of Isaac and I talking with the leader of the community and with women who wants to know more about the project. Here is our field worker in the team, collecting information actually on a cell phone. We are using EpiSurveyor, and here we are again talking with the community. And I took actually this picture 1 week ago when we went to Pucallpa. By the way, the name of the project is AIMBO, which means women in this native language, which is the Shipibo-Conibo language. So in summary, the impact that has had Fogarty on my career has been huge. After the Fogarty year as a scholar, I got 2 consecutive scholarships for postgraduate programs in the US, 10 articles published in peer-reviewed journals, 1 book chapter on the Bible of STIs, 5 grants including 1 GRIP, 2 from Merck, 1 Fogarty Fellowship, and 1 as a co-PI in a training running informatics that we have in Cayetano, Heredia. And I also got a New Investigator in Global Health Award from the Global Health Council 3 months ago. So actually the Fogarty program provided me with the most powerful tools I could ever ask to succeed, which are education and a strong scientific network of mentors and peers, and helped Isaac and I to find our way home to Peru and also to the jungle. Thank you very much.